Mr. Chairman, I call up Murkowski Amendment Number 1 as modified. This is an amendment that will establish an exemption process for patients or physicians in requesting an exception to step therapy protocol. Step therapy is one terminology for it. Others know it as fail first protocols. This requires patients to try and fail on a lower cost drug before they're allowed to access the drug that was actually prescribed by their physician. This has potential, as you would imagine, to harm patients. You have delayed access to the most effective treatments, sometimes with severe side effects, irreversible disease progression, certainly creates additional frustration for patients as they're seeking treatment. I think all of us have heard different stories from our constituents regarding step therapy and how they have just been frustrated and stymied by this process and in many cases, again, actually harmed. I have a situation that has prompted me to be engaged in this. This involved a young Alaskan child. He was required to fail on 2 drugs before his plan agreed to cover a newly approved drug that was very specific to his disease type. The newer drug they knew was going to deliver better results than the comparison studies, but they made him go through this protocol. He was finally granted the coverage for the innovative drug after about 6 months. But by that time, he'd already become so sick, he lost his colon. This boy was 11 years old, and he was forced to go through this process, a process that his doctor knew what he was taking was not going to be what he needed. So I think we can do better here, and the Safe Step Act actually helps us get there by providing a clear path for patients and physicians to request an exception. So it is something where we outline 5 exceptions to the first step protocols. And there have been some that have suggested that this will somehow increase costs. 36 states have already passed laws regarding step therapy reform. Experience with those laws have shown that step therapy reform has not affected costs in a negative way. So I would hope that each of my colleagues would support this amendment.